Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our every other week update on COVID-19 in Maryland and at GBMC. So today in Maryland, we have a test positivity rate of approximately 3%. What does that mean? That means that over the last 7 days, of all the patients who were tested for COVID-19, 3% of them were positive. Now that's an improvement of about 1% from where we were in July when we saw that uptick as people started getting a little lax in social distancing, hand hygiene, and the wearing of masks. Now, this statistic is consistent with what we're seeing in the hospitals of the state of Maryland. This morning, we have 453 people in Maryland hospitals who are COVID-19 positive, either in the intensive care unit or in regular beds. That's about 100 patients fewer than where we were in early July, or a drop of in the vicinity of 20%. At GBMC, our situation is consistent with what is happening in the state. This morning, we have 16 patients in the hospital who have tested positive for COVID-19, 4 of them in the intensive care unit, and only 1 requiring mechanical ventilation. In a previous conversation, I told you that our infectious disease experts believe that the number of patients requiring intensive care is going down somewhat because of our use of steroids and remdesivir to blunt the trajectory of these patients in the disease process. So people are still getting sick enough to get into the hospital, but of those, fewer are getting sick enough to require intensive care. Testing is more available now, and the national laboratories have significantly improved the turnaround time of test results. But getting tested is only a piece of what we need to do if we're sick. Even if we are not sick, we all need to wash our hands, wear masks, and to keep 6 feet away from others when possible to stop the transmission of the virus. Just because you are negative on one day doesn't mean that you might not be positive the next day. So wearing of the mask is stopping the transmission from you, and it is very important for people to wear the masks because of the number of people who get the disease and don't have symptoms and therefore don't know that they have the disease. So again, let me thank you for keeping social distancing, for wearing masks to stop transmission, and to wash your hands. The situation has improved in Maryland and locally since July. We need to keep working to stop the transmission, and that is the best way to keep ourselves, our family, and our friends safe until we get the effective vaccine. We're hoping that early next year, maybe sooner, but we're hoping that early next year we begin to see effective vaccines in production. So again, thank you. And don't be afraid to come to GBMC if you need care. Call your doctor. If it's an emergency, come to the emergency department. Thank you.